Okay. Well, thank you very much for having me today. I appreciate your time. I thought I would talk about what I do, but obviously I do work at the National Institute of Integrative Medicine. I've been here since it first opened, so that would be 14 years I think we've been open for, and I've been a naturopath for coming up to 20, or naturopath and acupuncturist coming up for 20 years. NIM is obviously quite a large organisation. Some of you might have heard of it already. So we have quite a significant amount of integrative GPs here. We also have an acupuncturist, a psychologist, a psychiatrist, there's a homeopath, and there's myself, the naturopath. The homeopath also does some naturopathy as well, so she does a little bit of both. And then we have an intravenous clinic where we do things like vitamin C, zinc, your B vitamins, things like that. And then we've also got hyperbaric chambers and also hypothermia as well running. So I thought I would launch into what I wanted to discuss today, and then we can go from there. And if you've got any questions at the end, then we can chat about those ones. So what I wanted to discuss first is my area of interest, which is what is integrative oncology. So this is a quote from a 2017 paper where they tried to come up with a more comprehensive, explanation of what it actually is. So it's a patient-centered, evidence-informed field of cancer care that utilises mind and body practices, natural products and or lifestyle modifications from different traditions alongside conventional cancer treatments. So integrative oncology aims to optimise health, quality of life and clinical outcomes across the cancer care continuum, and to empower people to prevent cancer and become active participants before, during and beyond cancer treatment. So we know that more than 70% of people that have cancer use complementary medicine in addition to receiving conventional care. We also know that cancer survivors have poor long-term health in comparison to, age-matched individuals, where they found that their general health status was poorer in those people that had actually survived cancer. So I think there's a big field there as well in terms of, how I can help. There's also been a massive amount of papers, obviously, on diet and exercise, improving long-term health in cancer survivors and even, people that have cancer. So obviously cancer survivors are at greater risk of secondary malignancies. So therefore, that's where you can look at, appropriate diet and exercise programs. I think that when it comes to the lifestyle side of things and the diet and, food and exercise and things like that, these are things that we can control. So I think it's important to try and take that power and, run with it, because I think often that diagnosis is, and going through conventional treatment, my patients often tell me that they feel very disempowered. So I feel like that integrative oncology gives them that power back, because it's about what can we do to support them in the best way possible. For me, and this is the same I think you'll find with most naturopaths, is that individualised treatment is the key. So naturopathic medicine focuses not just on the symptoms, but also on the cause, and it's the actual foundation of our health. This here is a quote from Jeff Bland, who is internationally recognised as the father of functional medicine. So he says that the future of cancer management is personalised, preventative, participatory and prospective in character. It will integrate genomic science with genetic expression patterns. And then it's about matching that diet and lifestyle to that person's needs. In terms of the aims in integrative oncology is that you want to be really reducing the side effects of conventional or orthodox treatment as much as we possibly can, preventing treatment resistance, and also promoting treatment efficacy. So in this, there are certain nutrients and herbs that are considered chemosensitizers or radiation sensitizers, so I would certainly use that appropriately. Balancing the immune system. So we know that the immune system isn't alone in playing a significant role in that prevention and treatment. So we really need to be looking at other bodily functions. So these to assess things like inflammation, hormonal influences, insulin resistance, digestion, detoxification, and things like that. Improve cellular signaling, reduce inflammation and its consequences, improve quality of life and long-term health outcomes. The next slide just goes through more aims basically. So the first one there is impact gene stability and gene expression. So an example of this is through, say, your tumour suppressor gene. So healthy cells contain tumour suppressor genes, which then suppress tumour or which then suppress cell division to allow a damaged cell to repair themselves or self-destruct, and that self-destruction is called apoptosis. And the tumour suppressor genes are often underactive in cancer cells. So the most well-recognised one is P53. So often there's actually quite a lot of research around this P53 because that's actually damaged in around 50% of cancers. So we look at what we can do to, support that P53. Addressing driving factors that may be contributing to carcinogenesis, supporting digestive function and nutritional status. So often, chemotherapy and radiation and surgery to a degree require a lot higher nutrients than what you would at other times in your life. So therefore, it's really about trying to make sure that that nutrient intake is nice and high, make sure that that person is consuming enough protein in order that they don't lose any muscle mass, or at least they're stabilizing their muscle mass. Inducing apoptosis. So obviously I mentioned that before. So apoptosis is that cell death, basically. So you want to induce cancer cell death. We try to support anti-angiogenesis. So we know that cancer cells go to great lengths to ensure that they have sufficient blood supply. And the body's process for developing these blood vessels is called angiogenesis. So then what we want to be doing is finding ways to shut down the blood supply to the cancerous tumour, and then we can hopefully, obviously slow down that growth of the tumour. Inhibit invasion and metastases, support the stress response and improve sleep, which are obviously pretty big given the trauma associated with the diagnosis and the trauma associated with the treatment itself. And of course, promoting safe and sensible use of over-the-counter supplements. That really goes without saying. If you're kind of seeing someone who's specialising in that area, you really are going to be getting that kind of safe and effective treatment anyway. The next slide just goes through, I guess, my most common aims in my practice in terms of how patients are presenting and what they want. And that would certainly be reducing those side effects and enhancing effectiveness, tolerance and manageability of the oncological treatment. So whether that's your chemotherapy, your radiation or your surgery. Immune and inflammatory assessment. So that might be pathology testing, like, looking at white cell counts and CRPs and so on and so forth. But it could also be something like live blood analysis. So here at NIM, we also offer something called live blood analysis. So for those of you that haven't heard of that, that's just a drop of blood that we take from your finger, pop it on a glass slide. I've got a big TV screen in my room, so I bring it up for you on that TV screen whilst I'm looking at it under the microscope, and that gives us indications about nutritional status, inflammation, white blood cell viability, and to a degree, around liver health and so on and so forth. So it's much more, I guess, a qualitative assessment of what's actually happening on the inside of your body. So whereas your standard blood test will tell you how many white blood cells you have, your what your ferritin is, things like that, this will at least one, you can see these things obviously straight away. As soon as it goes up, you know the answers to some of those questions. And so it's more of a qualitative assessment. So with something like white blood cells, yes, I can certainly look to see whether someone has a healthy amount of white blood cells or whether it's a little bit low. But on a live blood, you can also see how well functioning those white blood cells are, how healthy they are. So that's, obviously really important. Self-nourishment for improved quality of life, cancer survival, and then overall health, focusing on the pillars of functional medicine. So I mentioned these before, obviously, exercise and nutrition and relaxation and sleep and fatigue and mood and things like that. And I guess lastly, and certainly not least, but really coming back to what that person's individual goals are and their motivation. So I'll certainly, on that first appointment, I'll certainly be asking as to obviously what's going on currently, and then what's happened in the past, looking at any scans, pathology reports, blood test reports, things like that. And then obviously no naturopathic treatment would ever be without going through, food and nutrition and exercise and stress management and things like that. That was probably on the next slide and I didn't say that, sorry. In terms of the general dietary recommendations, you can see here this is what we call the real food pyramid. So it's not quite like the standard food pyramids you would have seen before. I'm very much a believer in real food, although I can spice some sausages on there. So I'm not quite sure that I would necessarily put sausages on a real food section. But anyway, that was the picture. And, we can't be too fussy with pictures from the internet sometimes. So ultimately, when the diet is certainly not a one-size-fits-all approach, and it is about trying to tailor that diet to that specific person. There's been some research done into specific cancers and their most appropriate diet. So for example, brain cancers will tend to lean towards a more ketogenic diet, which is a high fat, very low carbohydrate type of diet. Your pancreatic cancer and prostate cancer tend to lean themselves more towards a lower fat diet. Breast cancer tends to lean itself towards a Mediterranean style diet. But I think in all of that, it's actually about what's happening with the person as well. So if I've got a person where I know that the Mediterranean diet might be good for them eventually, if they've got raised insulin or raised glucose, or if they're, carrying a bit of extra weight, then I wouldn't necessarily do that diet straight off. I would be modifying that. And I think it's always about modifying it for that particular person. So, a healthy diet really does need to become a way of life. And it's, that anti-cancer nutrition plan focuses on making choices that will stimulate your body's innate ability to heal itself. So the idea is that cancer has a more difficult time living in an unhealthy person. It has a more difficult time living in a healthy person than it does an unhealthy person. So it's about trying to make that person as healthy as possible. So you can see here, all of those coloured fruits and vegetables. So really trying to eat a rainbow, your nuts and seeds, your purified drinking water. I would always suggest organic wherever possible. High fibre diet is extremely important, and that's not only important from a detoxification point of view, but certainly for certain types of cancer, we can see some very clear evidence to really point towards that, and in particular your hormonally dependent cancers and so forth for that estrogen clearance. Green tea is always a good one as well. I think that green tea is great, but I think it's, absolutely drink it, all the time. But I think it's one of those things where it's generally better used either in stage 1 or stage 2. It's not as well indicated when that cancer's a little bit further along. The other thing that I wanted to mention there is a low glycemic load and a low glycemic index diet. So what I guess used to happen years ago is that we used to think, right, well, we all should be eating low GI foods and then we'll all be super healthy. But the glycemic index is the amount of, it's the sugar itself and how quickly or how slowly that sugar gets released into the bloodstream. Whereas the glycemic load is how much sugar is in that food in the first place. So years ago, we used to just say, right, we just need to be consuming low GI foods and that was enough. However, you know, a really good example of this is ice cream. You know, ice cream is a low GI food. So therefore, you know, by that mechanism, we should all be consuming ice cream every day. And I feel like, you know, the majority of people out there are going to realize that ice cream is not a healthy food, and therefore somewhere along the line that's not quite right. So that's where it's about the low GL and low GI rather than just the one. On the next slide, this is more consume less of, so the sugar, the preservatives, the additives, the colours, the flavours, the alcohol, the soft drink, the refined carbohydrates and the packaged foods, any trans fatty acids, so things like your margarines, any fried food, any pastries, things like that. Smoked and processed meats is obviously a big one as well, since there's been a bit more evidence come out on the heterocyclic amines that are coming out as a result of either burning meat or, you know, the smoking itself can have some carcinogens and so forth associated with it as well. Ultimately, those refined carbohydrates are empty calories. So you fill up on those, and then basically it just means that you have less room for, you know, all of those good nutritious foods. And they're the ones that, you know, we really need to be focusing on. And, you know, when someone's undergoing treatment, they really have a much higher requirement. Cancer itself takes a lot of energy to grow. So it's really important to be making sure that we're giving that person enough energy for themselves, but not trying to obviously feed the cancer itself. The next slide, so exercise is obviously a really big one, and it's kind of too large to go through, you know, with this, you know, with a half an hour segment. So I wanted to just include a couple of quotes here on exercise. I think that sometimes with cancer, we tend to go straight for the super complicated stuff, whereas, you know, we've got this meta-analysis that was done in 2012 where they looked at 27 observational studies, and it showed that physical activity is associated with a reduced risk, so somewhere between 41 and 61% of all-cause breast and colon cancer specific mortality. So we know that exercise reduces obesity, which is literally an independent risk factor for cancer. We know that sitting is statistically associated with a 62% higher risk of colorectal cancer specific mortality. So, you know, we've got some really big things in there that we can make a change. And as it says in that second point there, these randomized controlled trials of exercise showed that exercise can also result in beneficial changes in terms of inflammation, insulin-like growth factor and insulin levels, and potentially immunity. So these are all things that we really do need to be trying to impact and so forth, and making these count. The next slide looks at meditation. Again, there was a meta-analysis of 10 studies which showed that there was a significant improvement in psychological and physical quality of life, and that meditation actually reduces depression, lowers cortisol. So cortisol is a stress hormone. It reduces interleukin-6, and this is an inflammatory marker, lowers systolic blood pressure, and improves natural killer cell activity. So natural killer cells are one of the, I guess, first white cells that are involved in cancer and so forth. So it's really important to make sure that, one, we have plenty of them, and two, that they're super active. The next study I love, this was literally entitled Forest Bathing, and I just thought it was beautiful. It was going out to a forest and hanging out in the forest for a few hours, and that was the study. I would totally be up for that study. And what they showed was that, they did these multiple reviews across a 5-year period, and what they showed was that natural killer cell activity and the number of natural killer cells all increased significantly, and that concentration of urinary adrenaline was a lot lower. So adrenaline being obviously another one of these kind of stressful hormones, I guess, to an extent. We need some adrenaline, but if we have too much, then it's going to be a problem. So also talked about, you know, a single forest bathing trip caused the natural killer cell activity to last for more than 30 days after a trip, which is very, very cool. And then, as it says there, that last paragraph is or the last sentence is a literal quote. The above findings suggest that forest bathing trips may have a preventative effect on cancer generation and development. So, next slide, I wanted to go through some of my favourite herbs and nutrients. Look, I could have, you know, written down 20 of them, but then I would have been talking for hours. So I really had to cut this one down. So it was tricky to just come up with a handful. So there's obviously always a level of complexity in choosing appropriate herbs and nutrients. So looking at that level of evidence available, looking at the type of evidence that's actually available as well, understanding of those interactions, which is a huge one, looking at the timing of dosing. So there are certain nutrients or herbs that we would use at particular times after a cycle or something like that, or before a cycle, depending on, and then utilising those dosings appropriately. The one of them, and I'm obviously this first one that you can see on this screen, is turmeric, which is one of my favourites. I'm sure that you all know about turmeric anyway. There's over 5,000 scientific studies and certainly well over 60 human clinical trials on turmeric. It's been shown to protect normal organs such as the liver, kidneys, the oral mucosa and heart from chemotherapy and radiation-induced toxicity. It is considered a radiation chemosensitizer. So I think, you know, and it's certainly particularly, it's sensitive to gemcitabine and paclitaxel. So I often will use this with your Taxol family to actually help combat fatigue. You can't use this with all chemotherapies. It doesn't work like that. There's not very many things that you can say that's really a one-size-all-fits-all approach where you can say, oh, that's good, you can take that, that's fine. There's a couple of things, but not very many. And you know, curcumin is one of those things where you'd have to be careful. As an example, you know, I wouldn't use it alongside your cyclophosphamides, as it can actually interfere with your anti-tumour activity. It has multiple targets, which is exactly what we want in something like, you know, pancreatic cancer as an example, as pancreatic cancer's got lots of genetic aberrations anyway, so we want to try and utilise those targets. You can see down the bottom there, you know, about some of those targets, the antioxidant side of things, the COX-2 inhibitor, the inducing apoptosis, so that cancer cell death, inhibiting metastases, upregulating capsase family, you know, inhibits NF-kappa B, your STAT3s, your PI3Ks, you know, the list kind of goes on and on. We do need to be a little bit careful with the turmeric side of things, just in terms of, well, not careful, but I guess aware that turmeric isn't all that well absorbed. So even though I would absolutely say eat turmeric all the time, even if you're on cyclophosphamide, food-wise, it wouldn't be such an issue. It's supplement-wise where it would become a problem. So I would absolutely encourage my people to be eating curries, or, you know, having roast veggies with turmeric on top of them, or maybe turmeric lattes, you know, anything like that. We do know that these what we call uncomplex turmeric doesn't really get from the gastrointestinal tract to the bloodstream. So really we need to be making sure that we're using the supplement side of things really well, and we're using one that's actually got some, you know, some reasonably good absorption, as opposed to just any old turmeric that's out there. So, you know, we think about smaller particle size, you know, phosphatidylcholine complexes associated with it, things like that. I also find that curcumin not only is a good one for fatigue, but also pain reduction, just because of those anti-inflammatory benefits. The next one on here was mushrooms. So all of those lovely medicinal mushrooms, so things like your reishis and your shiitakes and your coriolis. Chag is getting a bit more in the research and so forth now as well. This has been shown to improve disease-free survival in 31 randomized clinical trials in Japan, Korea and China. In fact, it's actually literally on the National Health Registry for Cancer Therapy. in those countries. So, that to me is, speaks extremely highly of mushrooms. Overall cancers, there was a 9% absolute reduction in 5-year mortality, and this means that there's an additional person alive for every 11 patients treated. So for me, I would, use mushrooms most of the time. I can't, there would be very few occasions that I wouldn't, but I would certainly, we know that combinations of mushrooms extracts seem to be more potent, and it says on that, obviously, that bottom sentence there, more potent apoptosis activity than when used alone. So I would tend to try to, utilize different mushrooms, and I often will tend to, if we're kind of looking at post-treatment, I'll often tend to, I guess, swap between different mushrooms and so forth anyway. So your mushrooms have numerous benefits on, obviously, the immune system, white blood cell count, fatigue, survival, obviously, and then that peripheral neuropathy to an extent as well. The next slide on there is glutamine, which is a great one. This is just a direct quote here. You can say, to maintain, this is just what it does, maintaining mucosal and gut integrity, improving immune competence, inhibiting cell proliferation, increasing apoptosis, increasing the synthesis of glutathione into normal cells, inducing heat shock protein synthesis, and increasing the synthesis of glucagon-like peptides, muscle mass, and mucositis, and ulcers. So there's lots of different uses for glutamine. I primarily would use it in the protection against the mucositis and the ulcers, and also peripheral neuropathy. And I do find it's quite helpful for diarrhea as well. Technically, it is. You could also use it for myalgia, which is muscle pain. I've had mixed benefits with the myalgia, but I think often with when people are coming in, I'm they're often on a few things. I won't necessarily put them on one thing. I might put them on a few. So it could be the glutamine that's helped. Otherwise, it could be a curcumin that's helped, or it could be something else that I've utilised. So I will use this for short stints only, and only with particular chemo. So it's not something that I would use routinely, and it's used for very specific chemo. So your 5-FUs, your capecitabines, and your taxanes, really beneficial, but other types of chemotherapy, absolutely not. So I think it's, it's one of those things where you just have to be quite careful with that one. But I still love it. The vitamin D is the next one. That's, again, got a, obviously a long list, and I'm sure that you guys are all very familiar with vitamin D, and hopefully you are all taking vitamin D anyway. There was a meta-analysis of 52 clinical trials that found that vitamin D reduced the risk of cancer, and that overall vitamin D supplementation was associated with a 16% reduced risk of mortality. The meta-analysis of the 52 clinical trials, that comprised of over 75,000 people. So it was a very, a very significant meta-analysis in terms of the numbers that were in there. I would say that with vitamin D, I would always use that really often at the start. And even if so ideally, I always like to know what people's blood levels are before I start on it. However, even if I don't know their blood levels, I'll often still use it, but potentially just in more kind of moderate dosing. And then once I find out what their D levels are, if I find out that they're quite low, and that's very common in the people that I see, then I would use much higher doses. So there's certainly evidence to say that if you've got a low vitamin D at the time of diagnosis, there's a poorer prognosis. So it's really, for me, as soon as I get them in here, I'm like, right, okay, well, we start on that, and then we look at your D. So I'm not talking about huge dosings of D initially until we actually know what those D levels are, but I want to be doing as much as I can for my patients. The next one in there is Ribrax, or which is often called BioBran. This is made from breaking down rice bran with enzymes from the shiitake mushroom. As I mentioned before, natural killer cells are the body's first line of defense against pathogens and cancer. So we want to be really trying to, look at what we can do around that natural killer cell, and it's able to increase natural killer cell activity by around 300%, and it also has an impact on T and B cell activity as well. You can see there that it's anti-inflammatory, it's got scavenging activity, and it also helps in the protection of lymphoid tissues. And it's also been shown to improve glucose tolerance and enhance pancreatic and liver function as well. There are some human clinical research in patients with breast, prostate, leukemia, and multiple myeloma, and again with that 300% activation of those natural killer cells. And there was a study that was done in Japan on looking at stage 3 and stage 4 cancer patients over a 2-year period. And this showed a statistically significant improvement in quality of life and a 50% increase in survival rate. Unfortunately, Ribrax is quite expensive. It's not a cheap one. However, if people can afford it, then I'll absolutely use it. The next one that I wanted to talk about was Withania, which is one of my favourites. I could only put in one herb here because otherwise you'd hear me talking for hours and hours against this topic. Withania is a great adaptogen. It helps with fatigue, be it physical or mental or mood or endurance. It also helps to increase GABA levels within the brain. It's also good for sleep. And it increases your dopamine receptors in the brain as well. So it's going to have that impact on anxiety. It's also immunomodulatory, and it's also neuroprotective. And I'll often use something like that, I guess, in recovery often enough against that conventional treatment. I'll often use it in a mix. The next one that I love is melatonin. So there's over 1,870 scientific studies on melatonin cancer. I know it says over 99, but it's actually over 105 now, I believe, clinical trials on melatonin and cancer specifically. It significantly improves complete and partial remission. It improves 1-year survival rate over control groups, and it also reduces radio and chemotherapy-related side effects like your low thrombocytes, the neurotoxicity, and the fatigue. In regards to low thrombocytes, that I often find is a tricky one to be supporting. We try and support it as much as we can, but sometimes those thrombocytes just get so low that it makes it quite tricky. So there's not that much from a research perspective that's really out there. It makes it really tricky. And even, my patients that have low thrombocytes and they don't have that diagnosis of cancer, it's a tricky one to treat. Often thrombocytes tend to be high and not low, so that's what the research tends to focus on. But back to melatonin, the effects were also consistent across different types of cancer as well. So it improves cytotoxic immunity by improving T cell function, and once again has an impact on these natural killer cells that I mentioned a few times over. Okay, so I wanted to go through a case study now, and then we'll finish up after that, and you can ask me any questions that you have. So this was a patient who was diagnosed with gallbladder cancer stage 3. By the time she saw me, she'd already had the surgery and she'd been on capecitabine. She arrived with, that is meant to be a Y, so clearly I didn't spell check that very well, but she arrived with poor energy. I always get people to rate various things as well as they possibly can. So her energy when she arrived was 4 out of 10. She had this burning sensation on her hands and her face, and her feet were really dry, but they weren't yet sore. She had these intermittent backaches, some diarrhea, and she also had this previous diagnosis of fatty liver and osteopenia, and her glucose levels were a bit high at 5.9. She had low zinc, and she had D, wasn't too bad, but wasn't fabulous. So I immediately, obviously because of those symptoms with that, the beginnings of what we call hand, foot, mouth syndrome, and that tends to, the research says that it tends to affect around 50% of people that go on capecitabine, although I find that quite a lot of, it seems to be, in my experience, quite a lot of my patients have it. I then started her on a particular type of curcumin, and we did quite a high dose, so 4 capsules twice a day. So curcumin only has a fairly short half-life, so doing it twice a day is generally better. I also started her on activated B6 because that's particularly effective for that hand, foot, and mouth syndrome and the redness and so forth that can come up as a result. And then we talked through diet. Because her hand, this burning sensation was starting to pop up, and obviously she was going to be on the capecitabine for a while. I got her to use, I said, use either coconut oil or emu oil on her hands. Her feet weren't too bad, but I said, look, if you're doing it on your hands, then do it on your feet as well. And then obviously try and avoid excessive stress and cold and so forth. Excessive stress and cold and heat. I saw her again 3 weeks later. Her energy had improved from a 4 to a 6. Her skin felt better. Her back pain had actually stopped, and her stomach was more settled. We talked about diet in detail. I then got, because of those bloods, I then got her to do something about the D and the zinc. But initially, if someone's arriving and they're feeling quite unwell, then I tend to really focus in on those symptoms first to try to get that person feeling a bit better, and then I will do some of those other things. I saw her a little bit later. I think it was another 3 or 4 weeks, but and she wasn't feeling so well. There'd been quite a bit of stress in the family. Her diarrhea had returned, her back pain was back, and she'd been experiencing headaches. The tingling and burning in her hands had stopped, and there was no increased sensitivity, which was great, but there was still some redness. So then we added in some magnesium in divided doses, and because she was getting diarrhea, obviously there wasn't going to be huge levels of magnesium, so we started low and then increased it. I popped her on a particular type of a probiotic, and then we discussed stress and meditation and sleep and things like that, added some bone broth. I saw her 3 weeks later, and her LFTs had all improved. I don't think I had mentioned that earlier in the slide, but at one stage her GGT, which is of course one of those liver function markers, had been up at 1,248, and it had now dropped down to 94. And so those other liver enzymes had reduced as well. And she had this CT, which showed no abnormalities, no evidence of metastatic disease in chest, abdomen, or pelvis. So she was completely wrapped. I think she must have got that information from her surgeon, because I saw her 1 month later, and she was told by her oncologist to literally relax and get on with life. Her LFTs, or liver function enzymes, had dropped again, so that GGT was now at 48. Energy, she had said, was 10 out of 10. The oncologist had stopped the chemo by that stage as well. We continued on some of those, like the B6, for a little bit longer, just because that hand, foot, and mouth syndrome is awful. So we want to be doing as much as possible to support it, and also, I guess, not kind of come off some of these things too soon, that some of these symptoms obviously come back and so forth as well. And then she was going away on holidays, so I had then started her on a bit of a combination of different things when she was off, and that had things like selenium and vitamin E, which are obviously really important antioxidants, mushrooms, which we've talked about today, curcumin, and extra vitamin D. So in short, that's obviously just one fairly short case study. In short, I really do think that that patient-focused integrative medicine is best. I find that integrative oncology is an invaluable tool for improving people's quality of life and their potential for positive outcomes. It improves people's sensitivity to conventional treatment. I find that it decreases side effects, and we always want to try to focus on the long-term health outcomes as well. For me, that patient-centered approach is of utmost importance, and I really do think that we can make some amazing, long-lasting changes if we do this correctly. Thank you.